Everyone, and thank you for attending our poster presentation on the impact of an online interprofessional training in tobacco cessation counseling on self-reported practice change and patient quit outcomes. My name is Shaliza Ahad, and I'm a project coordinator at the CAMH Nicotine Dependence Service, and I have no disclosures to report. To start off, treating tobacco dependence is one of the most proven cost-effective interventions in healthcare. Unfortunately, many healthcare providers report barriers to providing smoking cessation interventions, including a lack of skills and training. So, the Training Enhancement in Applied Counseling and Health, also known as the TEACH project, is a knowledge translation initiative that offers accredited and competency-based training in tobacco dependence treatment to multidisciplinary healthcare providers. As part of our program, TEACH offers a fundamental course on treating tobacco dependence known as the TEACH Core course, which focuses on evidence-based intensive tobacco interventions to help healthcare providers build capacity. However, the extent to which training impacts long-term practice change and patient health outcomes is unclear. So in this study, we applied Moore's 7-level evaluation framework, which is often used to evaluate outcomes in continuing education, in order to investigate, first, practice change among healthcare providers participating in the TEACH Core course, level 5 of the framework, as well as patient-reported smoking abstinence following treatment offered by either a TEACH-trained healthcare provider or healthcare providers trained in less intensive training programs, level 6 of the framework. To evaluate clinical practice change, we used McNemore's tests and descriptive analyses to measure self-reported practice change from baseline to 6-month follow-up in 8 core competencies related to cessation counseling. Our sample included 62 healthcare providers who attended the TEACH Core course in 2015 and 2016. For level 6, we used secondary data analyses to measure patient-reported smoking abstinence at 6-month follow-up in 2 overlapping samples of patients enrolled in a smoking cessation program between 2014 and 2016. Patients received all or most treatment from one healthcare provider who was trained by either TEACH or another training program. Results from our analyses found that, compared to baseline, significantly more healthcare providers reported delivering cessation counseling 6 months after taking the TEACH Core course. For level 6, after adjusting for both patient and practice level covariates, we found a significant association between being treated by a TEACH-trained healthcare provider and the likelihood of smoking abstinence at 6-month follow-up in both the all treatment and most treatment sample. We conclude that implementation of intensive interprofessional trainings can support healthcare providers with sustained practice change in delivering cessation interventions and can improve patient health outcomes. For more information on participating in our TEACH certificate program and joining our community of practice, you can check out our links below. Thank you so much.